Hi, I'm Ruth. I'm a nursing instructor, and I'm going to show you how to do a sterile dressing change. Okay, so we've already looked at the chart, we've looked at the orders, we've identified our patient, we've set up a red bag, we have clean gloves, we have a kit. So I'm going to start by putting on my clean gloves. I've already washed my hands. I'm going to use clean gloves to remove this dressing. Now, when you're pulling tape, guys, I want you to pull the tape toward the wound like this so that we're not putting traction on the skin and we're not hurting our patient. This is a sterile wound, so I'm using a pinch motion to pick up the dressing so that I'm not contaminating in there. And then you're going to do your assessment, right, the taco, by looking at the type, the amount, the color, the odor. I'm going to drop that into a red bag. If it was a very small little dressing, I could just wad it right up in my glove. Okay? So peel that off. And now I'm washing my hands in my magic sink. Okay. And I'm going to open my kit, and you are going to refer to the sterile dressing change, pardon me, the sterile gloving video for gloving. Okay. So I'm going to open my kit. This drape you really are not going to use very often. If you had a leg wound or something, you could use that, but in our case, we don't need it. And here's where you're going to go watch the sterile gloving video. Got my red bag, I'm wearing my sterile gloves. At this point, pick through your kit and decide what you're going to use. I have a set of sterile cotton swabs down here I'm going to be using. I have my forceps I'll be using. There are scissors in there. Should you require them today, we won't. And this is my abdominal pad. Sometimes we call that an ABD pad. That just goes on top. Okay, so now I'm going to have my assistant, who's my friend, going to come in, and I've separated out my gauzes. I have some here that I'm going to cleanse and fill the wound with, and I have dry that I'm going to cover with. So she's going to pour by not reaching across my sterile field. Thank you very much. Okay, now at this point you can pick these up and wring them out because you're wearing sterile gloves. I'm over my sterile field. You can either cleanse using these forceps or you can just use your hand, and I'm going to show you how to use the forceps today. So go ahead and pick it up and wad it up like this. You're going to cleanse this as if you're cleaning a meatus, a penis. So you're going to start at the most central location, which is always the most sterile. Okay, so I do one swipe and pitch it, and I pick up my next one, and I go out a little more, and I pitch it, and then I would continue to repeat the process until I had completely filled the wound. So we clean the wound, and now we're going to fill it. At this point, you can use your fingers, guys, if you want, or you can use these cotton swabs for this. Either one is acceptable. That's up to you. What you do want to do is open this up to expose as much of the mesh as possible to trap wound debris and drainage. And as you put this in, sort of use an exaggerated motion so you make sure you're not dragging your gloves through here. And you're just going to lightly fill. We pack suitcases. We don't pack wounds. Okay, I'm lightly filling. I'm going to continue to do this until my wound is all filled. We don't want any of it not to have dressing, but we don't want to jam it full either. Okay, and right here I'm getting a little close to the edge, so I might use my cotton swab here to keep me from contaminating. Okay, at this point now I'm just putting on dry gauze, and the dry gauze can touch the outside edge. That's fine. I'm going to cover my entire wound with this. And honestly, we would be using bigger gauzes for this. And then we're going to use our abdominal pad, and think blue stripe goes to the blue sky. I put that on top. And at this point, I'm going to take off my gloves, wash my hands. I'm putting on my clean gloves. I'm not sterile anymore. And I'm going to put on my tape. Alternately, if you were just going to throw away that roll of tape, you could have just left on your sterile gloves. But you know that because you've been touching the patient and so forth, once you touch that roll, it's got to go. And then just put on your tape and go chart, and that is it.